Good morning, everybody. You know, some of you may remember the story about in the mid-19th century, shoe manufacturing in Manchester, England, and in Boston, Massachusetts was sort of the shoe manufacturing, boy, that should be interesting, of the world. And these two competing companies were looking to expand market share. And they both sent representatives independent of one another to Africa. And the first representative sent a telegram back, bad news, they don't wear shoes down here. The other representative sent a telegram back and said, wonderful news, they don't have any shoes yet. And like most of you in the room and myself, I think that's a good analogy where healthcare is now. Same world, same environment, two different worldviews. One depressed, beat down, the other full of optimism. I'm using Dickens' The Tale of Two Cities, which we all had to read in the 9th grade. Is sort of the preamble to my conversation with you today. And I think this captures American healthcare. In the emphasis on the end of this quote, we had everything before us. That's mine, that's not Dickens. It's his quote, but it's my emphasis. And I think we do. We have everything before us in a great deal of opportunity, as Alex pointed out in his talk. So what I want to do is take a quick high-altitude snapshot of the key movers in healthcare today and how it impacts all of us in the room and Skyline in particular. And Alec talked about quality, and I refer to it as the quality myth. And I'll give you an example of that mythology. Who measures quality? This is very interesting to me. You know, we see billboards all over California. This hospital is rated in the top 100 by U.S. News and World Report, etc. The four can you go back? Thank you. The four major rating agencies, U.S. News, Leapfrog, Health Grades, Consumer Reports, rated 834 hospitals. Not one of these four agencies rated a hospital as the best, and another one. Some actually rated some best and some the worst. And this is where a lot of our patients and consumers go for information. Being rated number one by U.S. News and World Report or the top 100 doesn't mean a thing. But the public perceives that. What's in play? We know that the $3 trillion in American healthcare is 1/5 of the economy. It's 18% today. The Office of Management and Budget in Washington has a target by 2025 that it will be 15% of the gross domestic product. Major players are dominating the healthcare environment. Here in California, Anthem Blue Cross and Sutter Health up in Northern California are in a major legal battle over rates and access to markets. Nationally, again, Alec alluded to this, Aetna bought Humana for $37 billion, Anthem bought Cigna for $48 billion. That's real money. We talked a lot in 2008 in the presidential cycle about single payer. And sort of the consensus was that America doesn't want a single payer. Well, I'm suggesting that pretty soon we're going to have 2 or 3 payers. And it's interesting to note that the 4 largest health insurance companies have 3 times as many insured lives as Medicare. The other thing that's interesting is that profits are at an all-time high in health insurance companies, and their cash positions are at all-time high. Unsustainable cost of hospitals. Hospitals represent about a third of the $3 trillion in American healthcare. There are 4,900 acute care hospitals. They consume $970 billion, more than Social Security and more than national defense annually. CMS projects that by 2025, there will be 2,000 acute care hospitals in the United States. More than half will be gone. 40% of those hospitals are losing money. Where does Obamacare fit? In spite of all the politics of Obamacare, it's not going to go away. And actually, if you look at it, it's doing quite well. 17 million people are now enrolled. 3 million have been added to parents' plans. It's overall ahead of goals. There's an additional 3 million who are not counted here, who have been excluded from the insurance market historically because of pre-existing conditions, and they are now have access to health care, albeit it's very expensive. Transformation of primary care and beyond. The big matrix here, national corporations are becoming leading providers of primary care and referral to specialists, and physicians are being replaced, which is not a bad thing. Physicians are being replaced by physician extenders, PAs, and nurse practitioners. To that point, now here at Skyline, we have, under the leadership of our physician partners, a very aggressive strategy of partnering with physician extenders, PAs, and nurse practitioners. And Yasmin Khan will be heading up a program to facilitate recruitment and onboarding of physician extenders and developing programs uniquely designed around them. So physician extenders are a key part of the healthcare new paradigm. And the good news is it allows a lot of specialists to free themselves up to really look at the complex cases and really take advantage of what they like to do and what they were trained to do. To me, this is the biggest driver in healthcare today. The consumerization and retailization of what we used to call patients. We've gone from fee-for-service in a locus of hospitals and physician clinics to healthcare centers and pharmacies, and we are entering the area of overall case management, as Dr. Koo alluded to, and a key metrics for healthcare. We're entering the era of big data and analytics. If cash is king in an organization, and I think it is, I think data and analytics is queen. Without analytics, we will be at an enormous disadvantage. The other big driver on this continuum is virtual access, iPhone. That is the connection to your patients and to our customers. I want to talk a little bit about what used to be CVS Pharmacy. Note the name. At the corporate office, they've now changed it to CVS Health. They're now a health company. They're the largest healthcare company in the United States. They have annual revenues of $140 billion. We think of Big Pharma, many of our friends are here from Big Pharma, as really titans. If you combine Pfizer and Merck together, they're $90 billion. CVS is $140 billion. They're the largest operator of health clinics in the United States. Largest dispenser of prescription drugs. Second largest pharmacy benefits manager. Not only do they manage their own pharmacy and benefits, they manage other companies. Let me walk you through what happens when you go into a CVS clinic. I don't know about you. When I spent most of my career in Northern California, And CVS pharmacy was a place you only went if you had to. If there's no place else open to get a prescription filled, or you needed some late night school supplies. I never thought of that CVS as a healthcare provider. You walk into a CVS health center, you're registered, you're given a membership card, and you're guaranteed to be seen within 20 minutes. You are seen. As you walk out, you walk 20 feet to the right, and if you need a prescription, it is there waiting for you. And as you leave the store, if you like, you can pick up your school supplies or whatever. Your membership card, when you check out and pay, everything goes into a computer. They have a complete profile of you and your shopping habits within CVS. The cost for the visit is $59. Within 48 hours of your visit, you receive a text or a telephone call from a professional in CVS asking, Mr. Hudson, how are you feeling? Are the drugs working, et cetera, et cetera. Constant contact and communication. All the CVS clinics are run by mid-level providers. There is one medical director for 3 clinics. At any one time, that physician can be supervising from between 12 and 20 mid-levels at 3 different sites. He or she sits in a room in front of a bunch of computer screens and knows what's going on in every clinic. Okay. Urgent care and beyond. This is the national snapshot. 10,000 facilities. And by the way, several states have tried to restrict health clinics run exclusively by mid-levels, and the Federal Trade Commission and the Department of Justice have come back and said, quote, "You are not a cartel, you do not manage the healthcare market." Okay. Walgreens is another example, and this one is particularly interesting, I think. Largest retail pharmacy in the country, 6.3 million customers a day. Walgreens has gone from, in 5 years, from walking down the aisle and having a blood pressure machine that you could check your blood pressure on, or the following autumn to have a flu shot, to now chronic disease management. That's urology. Chronic disease management. They've gone in 5 years from flu shots to chronic disease management. Okay. This is one that I'm also fascinated with, Walmart. I've never been one to associate Walmart with excellence. Matter of fact, as somebody told me at dinner last night that I was an elitist, and I think they meant it as a compliment, but I've never been in a Walmart for many reasons. But Walmart has decided to have their own insurance product. Their first step is they've enrolled all of their employees and their families, 1.1 million. And they're rolling that product out to others. If you go to a Walmart health center, the visit is $40. If you're a Walmart member, it is $4. If you have a cardiovascular issue that requires intervention, they fly you and your family to the Cleveland Clinic. Cleveland Clinic. If you have a spine issue that requires surgical intervention, they fly you and your family to Virginia Mason in Seattle, and they bring you home. Walmart also guarantees you that they will see you within 20 minutes, but they don't want to see you in less than 20 minutes. When you check in, they give you a little beeper. Mr. Hudson, we'll be with you in a few minutes. Take your time, walk around the store, and do some shopping. If you pick up something that's going to fall apart after you wash it a couple of times, but as you check out, they won't send you to another cashier. They'll take care of everything there. You're also in their data analytics system forever. But look at Walmart who's never been synonymous with quality, and look who they're contracting with based on alleged outcomes and bundle payments. Pretty impressive. This is an interesting slide for me because we're moved from a cost of fee-for-service environment to a increased expectations. And again, one of the things where consumers go is to look at things like health grades and US News and World Report, and we know that those are faulty. This is based on Pew Research and others. 62% of customers, healthcare customers, say they want to be connected virtually with their provider. That's an iPhone, by the way. Access is the competitive advantage. And what the research shows, it doesn't mean that it's 10 minutes from your house. Anything that's within 45 minutes of either your office or your home is considered acceptable. What the research shows access means after 6 o'clock at night, Saturday and Sunday. CVS is open from 7 a.m. to 10 p.m. in their healthcare clinics 7 days a week. Other interesting findings. Convenience is a top factor. Ease of appointment. 40%, if I have consistent long wait times, I'm going somewhere else. I met an executive of CVS a couple of years ago, and she said to me, she says, we don't have patients at CVS. We have individuals and we have customers. And we don't have patients, and the customers we have are not patient. They have high expectations. Customer-centric. Okay? Skyline, price and value, information transparency. I want my lab results on my iPhone the same time Dr. Koo sees them. Results for quality and outcomes. Superior customer experience. Superior customer experience. Highest satisfaction, demonstrably, that means in the top 1 percentile of Press-Gini for us. Customers who are loyal and stick and brag about Skyline to their friends and family, the Skyline brand. Every touch point is an obligation to build the relationship. I was meeting with, over coffee with 3 office managers about a month ago, and they are very good managers. And sort of the theme was complaining about all the phone calls that come into their clinics. Every phone call is an opportunity. Every phone call is a touch point. Now, those calls need to be analyzed. If they're repeat calls or people calling back because I didn't get my lab results, those are other problems, but they are touch points. And why are the big corporations getting into the game? Well, close to 1/4 of the $3 trillion is really at play. Higher deductibles, co-pays, so $700 billion can be driven by customer choice, consumer choice, not by their payer classification. And what's interesting on this graph, and I think it's good news, you look at the highest areas of opportunity, and they are pharmacy, medical specialties, procedure specialties. That's us. Not way over here in skilled nursing facilities or rehab. So as we look at very finite resources to make investments, I think this is a good graph to take into consideration. These are where the opportunities are, the high yield opportunities. This is a very busy graph, but I'm just going to touch on a couple points here. Fee-for-service, patient volume is the matrix. consumer value is around risk bundled payments, high integration of electronic connectability, and superior customer service. That's the continuum, and there's a lot of opportunity there. So, how do we respond to some of this here on the ground at sea level? Well, with the assistance of our good friend Bill Ross, who's our contracting negotiator specialist par excellence, and Monica Kim and the CFO, we are reaching out to Walgreens, CVS, and Walmart to see if we can start a dialogue. So we'll see how that goes. Can you go back just for a second? Thanks. Again, big data, combining lifestyle and healthcare and analytics. We have to make some investments there, but prudent investments, and this leads to the next slide, what we shouldn't do. We can't do it all. We shouldn't try to. There's no such thing as the best, perfect IT platform. There's a joke in Silicon Valley that you can spend a little bit of money on IT and be very unhappy, or you can spend a lot of money on IT and be very unhappy. So I think we need to be very prudent. Own it all. We don't need to own nursing homes. I'm a great believer in staying in your lane. Stick to your core competencies, do them better than anybody else, and what you don't have under your corporate umbrella, build relationships with. Bring in a new workforce. Hospitals, the reason they're going out of business is they're famous. Every time there's a problem, they hire 20 staff. Not good business, and it certainly doesn't yield good results. But what we have to confront, and we have to confront it openly and honestly. Cultural resistance. We have to move away in organizations that we allow naysayers to dominate the conversation. Service silos. Alec alluded to that in his talk. Leadership that walks the talk and is on a constant theme of the whole is greater than the sum of parts. Scarce resources. One of the biggest resources that we need to invest in is time. Time for continuous training, time for planning, time for partnership retreats, and moving away from the protection instinct of fee-for-service. It's gone. And really looking at and developing and testing new reimbursement models. Because believe me, the payers don't have the answer to that. Of course, all this means is the rate of change is accelerating. The threats are accelerating. The opportunities are accelerating. We have to partner with organizations, both in healthcare and outside of healthcare, that share our core values. The fundamental core value is patient first. Experts agree by 2020, and some of them will be speaking later on today, if we're going to have a fully physician-owned healthcare company, these are the minimum threshold requirements 4 years from now. 75 plus physicians, 2-for-1 ratio of extenders. That is, if you use that matrix, that's 225 providers. Standardized clinical pathways, et cetera, et cetera. These are foundational. That is, they're not incremental. They're all interrelated. This is Annabelle's artwork. That's really kind of how we look at executive committee meetings. I really believe, I wouldn't be standing here, that we are, Skyline, uniquely positioned to take advantage of this new world. But I want to be clear, uniquely positioned is not synonymous with easy. A lot of hard work ahead. I want to kind of wrap up a little bit with a personal vignette. Many of you probably know or have heard of Benjamin Zanter. He's the conductor of the Boston Philharmonic. He's the author of the book, The Art of Possibility. He just celebrated, I think, his 78th birthday. And he's also a leadership coach and facilitator for Fortune 500 companies, including healthcare companies. I met him a few years ago, about 12 years ago, when he was speaking at the Commonwealth Club in San Francisco. And then I subsequently went to a couple of his events. All his events, by the way, are private. It's by invitation only. And so I snuck in the back door, basically. I learned that he and I have one thing in common about leadership, and I was really surprised to hear this. He is an accomplished conductor of an orchestra, but he uses the conductor as a metaphor for leadership. And that is, a conductor doesn't make any sound. A conductor empowers and brings out the best of people that he or she is interacting with, and does that in a way of harmony. I've always liked that as a sort of a metaphor of what good leaders should do. And he uses the example of shining eyes to measure how effective he is being. He says that when he looks around a room or interacts with anyone, if there are shining eyes, he knows that he's empowering and connecting. Think about it. Think about your children, your pets, shining eyes. So I'm going to show a 2.5-minute video of Shining Eyes, which is our own Skyline staff in a customer service training program. Nikki Dashty and Shavia put together one of the best customer service training programs that I've ever seen, and I've seen some of the best for healthcare. And 9 different sessions, 3 hours each, spread over several weeks, every region of Skyline. And I'm so proud of looking at my colleagues in this video and see how they interact. But look for the shining eyes. First thing I want to say is how happy I am and how proud I am to be your colleague, because I know how challenging and rewarding your jobs are. I mean, we have the best physicians and physician assistants and nurse practitioners, I think, in the western part of the United States. But none of that could happen without your interacting with our patients and their families. So I know how difficult your job is, and I appreciate it, and I'm very proud of you. Today is meant to give you, not to say to you that you don't do good customer service, but to give you some sort of the state-of-the-art tools that can help us all be better at customer service. And it's also an opportunity for you to have suggestions and input. We want to treat every patient and their family or their loved ones as if how we would like to be treated, or somebody who's our loved one. That should be the standard, that we treat everybody who comes through our door in that caring, supportive way. It's everybody's job. Number one priority is to acquire and retain good customers. Should be a fun afternoon. I'm going to be with you all afternoon. So, thank you.
What is Skyline, right? Who are we? What do we stand for? We're gonna play a little game here. We're actually gonna get up and go to our easels. We want to put the care back into healthcare. So we want to tell our patients to take care as they're leaving versus have a nice day.
So that means you're the most important piece when a customer comes in is a positive staff. You want to treat other people how you would want to be treated. Airline passengers want more than a flight. Hotel guests want more than a room. Restaurant patrons want more than a meal. So why wouldn't healthcare customers want more than just a place to be medically treated?
Shining eyes. Did you see it? I mean, look at Richard David. He could light up a dark room. Shining eyes. For Skyline, this is the best of times. Thank you very much.